Hello guys, welcome to MedMapple. On today's topic, we are going to see about diuretics. First, we'll see the classification of diuretics. The diuretics, these are mainly classified into three types: high ceiling diuretics, medium efficacy diuretics, weak or adjunctive diuretic. High ceiling diuretic. These are the inhibitors of Na plus K plus 2 chloride co-transporter. So the drugs under the high ceiling diuretics are furosemide, bumetanide, torsemide. So under the medium efficacy diuretics, there are two groups: benzothiazidines, thiazide-like diuretics. Under the benzothiazidines, the drugs that comes are hydrochlorothiazide, hydroflumethiazide, and benzthiazide. Under thiazide-like diuretics, the drugs that comes are chlorthalidone, metazolone, zipamide, indapamide, and clopamide. Next, the weak or adjunctive diuretics. These are classified mainly into three types. First is carbonic anhydrase inhibitor, potassium sparing diuretics, then osmotic diuretic. So the drug under carbonic anhydrase inhibitor is acetazolamide. Under potassium sparing diuretics, it is classified into two types. One is aldosterone antagonist and the other is renal epithelial sodium plus channel inhibitors. Then the drugs under the aldosterone antagonist is spironolactone and eplerenone. Under Na plus channel inhibitors, amyloride and triamterene comes. Next, osmotic diuretic. There are three drugs, that is mannitol, isosorbate and glycerol. So in this video, we'll mainly see about high ceiling diuretics, in specific furosemide. Okay, so high ceiling diuretic. These are also called as loop diuretic. The drug we are focusing here is furosemide. So we'll see the mechanism of action of furosemide. Furosemide, these blocks the Na plus K plus 2 chloride co-transporter. So inhibition of this co-transporter inhibits the Na plus and chloride reabsorption in thick ascending limb of loop of Henle. So, generally in the loop of Henle, large amount of NaCl will be reabsorbed. But the loop diuretic acting here, it causes excretion of large amount of Na+. So, this is highly efficacious diuretics. The other actions of furosemide includes increased excretion of ions like potassium, calcium and magnesium. Then there is increased uric acid reabsorption in the proximal tubule. Vasodilation occurs in renal vasculature. They also induces the synthesis of prostaglandin E2. The prostaglandin E2 synthesized, which inhibits Na plus reabsorption in the loop that causes diuresis. Next, venodilation. The venodilation occurs which relieves the pulmonary edema. Pharmacokinetics. The drug is completely absorbed orally and they are firmly bound to plasma protein. So the dose of furosemide is 20 to 80 milligram in morning. Next, adverse effects. So first, the electrolytes. We saw already that all the electrolyte level is decreasing here. So there is decrease in potassium, that is causing hypokalemia. Decrease in sodium causes hyponatremia. Decrease in calcium causes hypocalcemia. And decrease in magnesium causes hypomagnesemia. Next, metabolites. There is increased glucose level, so which leads to hyperglycemia, and there is increased lipid level which causes hyperlipidemia, and increased uric acid level causes hyperuricemia. So other adverse effects here includes ototoxicity, hypovolemia, dehydration, hypotension, alkalosis, GI disturbances, weakness, fatigue and dizziness. Uses. So the clue here is H3O flows. So under H there are three things: hypertension, hyperkalemia and hypercalcemia. And the O here represents edema. So under edema there is pulmonary edema, cerebral edema, hepatic, renal and cardiac. Then for F there is failure. So under failure, there is acute renal failure and acute left ventricular failure. Then there also occurs forced diuresis. So here we have seen about the loop diuretics or furosemide. This is enough to cover all the important points under each headings. So do follow up, do subscribe, do like, do share to get more contents related to it. Thank you.